Palliative care centers are being developed a lot lately. Now, what are they? How are they any different? Now, if I talk about them, they are specialized medical care centers specifically for people living with a serious illness such as cancer or heart failure or many other chronic diseases. It is a common practice to usually put patients who need a 24/7 care in palliative care in Western culture. Now, World Health Organization defines it as an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illness through the prevention as well as relief of suffering. What is it in India? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the need of palliative care centers in India and their success rate in convincing for the need of palliative care. A recent study published in the Indian Journal of Palliative Care aimed to estimate the need for palliative care in an urban resettlement colony in Delhi, India. The study that I'm talking about revealed that the need for palliative care in an urban resettlement colony in North India was necessary. Moreover, the awareness about the palliative care being poor made its need less. A community-based cross-sectional study was performed where the researchers trained 4 multi-purpose workers to screen the households during their routine household-to-household visits. The screening for the need of palliative care was done using 3 major questions. Firstly, whether the presence of a bedridden patient was there, or if a person in need for any help in activities of daily living, or thirdly, not able to go to work due to any physical chronic illness. Now, if the answer to any of these 3 screening questions was yes for any member in a household, then these households were visited by a community physician trained in palliative care and a medical social service officer to confirm the need for such a care. So patients were administered a semi-structured questionnaire containing their socio-demographic details and an assessment of disease status, and the review of health records was all cumulated and done. The patient and his or her caregiver were also assessed for awareness regarding this concept of palliative care. So a total of close to 2028 households were screened, and it was found that the need for palliative care was found to be 1.5 per thousand population. So the common diseases which required palliative care were stroke with a focal neurological deficit, which constituted approximately 45.8%, osteoarthritis with marked dependence at 20.8%, and cancer at 12.5%. None of the patients were receiving palliative care, as patients and their caregivers were not even aware of this term, and that is the palliative care or the end of life care, home care for bedridden people, or even community-based care. So the researchers concluded that the need for palliative care in an urban resettlement colony of North India was found to be 1.5 per thousand population. However, although this concept is still in its niche stage, that is in the initial stage, but awareness is definitely required to estimate the need for palliative care in India. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.